everybody. Welcome back to another episode of Talking in the Attic. I am Tevis, and my wonderful co-host is
William J. Also Joseph or Joe, as Tevis calls me.
That's how I was introduced. Like, I don't know what you want me to call you. So,
hey, let's not get into that.
All right. So we are your wonderful co-hosts for the next 45 minutes to an hour. We have a wonderful clinical psychologist with us who is going to talk about, just some mental health aspects, what she does, how you can get into a routine of mental health and wellness. And she's also my boo. So we know each other for a very long time. So I'd like to introduce everybody to Dr. Kristin Joy Carothers.
Hello. Thank you for having me, Tevis and Joe. I'm happy to be here.
Thank you. Okay.
Pleasure.
We're just going to jump into it as always. So Kristin, you are a licensed clinical psychologist. So
yes.
What, sparked your interest? What made you get into this field?
Okay. Thank you for that question, Tevis. I think I probably became interested in the field when I was about 12 or 13. My family in St. Louis had a home for children who were born addicted to drugs. So my mom's first cousin was a registered nurse. Her name is Mildred Jameson. She started a place called Faith House in St. Louis. And the purpose of Faith House was to take babies who'd been born at the hospital, drug addicted or with drugs in their system. And she became the home where those babies would stay until they got foster care placement or adopted. Over time, this place grew into a whole village, right? Had awesome services for children whose parents weren't able to care for them. We went to visit. And on one of the visits, I learned that there were psychologists who worked with the children as they had developmental issues or just issues coping, et cetera. And so I said, oh, that sounds cool to be able to work with kids. And so I think that's where I kind of got my, what is a psychologist? There are people who work with children who have difficulty adjusting because of something that's happened in their environment. And so I think that's what sparked my interest.
I didn't know that. This sparked your interest when you were 12 or 13. You did go to school for clinical psychology. So what kind of schooling did you have to go through? How long was the schooling? And then I know, there were internships, externships. Can you kind of explain the whole process of becoming a clinical psychologist?
Yeah, so Tevis has been my friend for a long time, so she knows that the journey was a long one. From the time I left undergrad, so in undergrad, I majored in psychology at Howard University. While I was there, I spent a lot of time doing research-oriented programs. My work study was as a lab assistant in a psychology lab where a principal investigator was doing research on identity and success and race. So I knew, okay, I want to become a psychologist, but what kind of psychologist do I want to be? So that what people don't understand is there are lots of different types of psychologists: industrial, organizational, experimental, school psychologist, educational psychologist, experimental psychologist, clinical psychologist, counseling psychologist. A clinical psychologist is somebody who specializes in working with people who are experiencing mental illness or mental or emotional symptoms that would warrant a diagnosis of anxiety, a depression, bipolar disorder, or who might be dealing with personality disorders. People like to throw out narcissism or borderline personality disorder. A counseling psychologist also does therapy, but they're helping you with general life stress. So you through a separation, you got a change at work. So a clinical psychologist specializes in the diagnosis and treatment, research, and teaching related to emotional health, well-being, specifically what we would call mental health disorders. So I had to get a PhD and a master's. Ultimately, you have to get a PhD to be called a clinical psychologist. And I did that at DePaul University.
So it's so the 4 years of undergrad and
4 years of
and then how many years of the master's and the PhD program?
So the master's PhD program was one program that was 6 years in length. So about year 2.5, year 3, you get your master's, but they don't let you leave because the goal is not for you to stop there. Okay, so some schools won't even let you walk across the stage when you do their master's work because they're like, no, you got to get that PhD. So it's like another 4 years because we have 1 year of clinical internship. So after we finish our dissertations, we have to then apply out around the country to a different setting to be trained, not just, so they don't want you to just be trained by your school. They want you to have exposure to training by somebody else. So I did DePaul for master's PhD, applied across the country, matched at Columbia University, New York Presbyterian Hospital. And I went to New York for my internship, which is 1 year before you're granted the doctorate. And once you've done that internship, now you're officially a clinical psychologist.
Good child. That's a lot.
Good child, right.
That's a journey right there.
Yeah, when I was in school, everybody's like, what are you doing? Are you really in school? So it was a long time.
Okay, so you kind of alluded to this in the previous question. So what is the difference between just a regular psychologist and a clinical psychologist?
Okay. Excellent question. So I think most people are, when they're thinking of a psychologist, there's either a school psychologist, that's a person who works in schools and who basically does evaluations of kids to figure out if they have a learning difference. So a reading, math, disability, right? That's a school psychologist. Or maybe a psychologist who's not a clinical psychologist, but who's a counseling psychologist. So you're going through your employee assistance program at work because you want to reach out and work with somebody. That may be a counseling psychologist. It could also be a clinical psychologist. Then when you think of a clinical psychologist, you're thinking about somebody that you might be referred to by your psychiatrist or your medical doctor or in a hospital setting, because we're pretty sure you've got like a generalized anxiety disorder or you've got a major depressive disorder that's recurrent. Like there's some level of symptomatology that is kind of organic or not just caused by life stress.
So it's more like physiological.
Okay. Yeah, there's a physiological basis for it. And then there's some also environmental factors that kind of create the perfect storm.
Okay. So do you have like specific treatments that for like, that only you as a clinical psychologist can practice as opposed to like a school psychologist?
Yes. Okay. So a clinical psychologist, clinical psychologists do neuropsychological testing. So if we're trying to determine if a kid has autism, a clinical psychologist is a person who does the testing to figure that out. Neuropsychological testing, okay, I'm trying not to go too deep with this, y'all. Clinical psychologists diagnose, assess, treat. In some states, medical doctors who are psychiatrists, clinical psychologists who are PhDs would be the only people who can do the diagnoses. So if you are a licensed like practical counselor, technically in like the state of Georgia when I got here, you weren't supposed to be able to diagnose. But now in the state of Georgia, that's now changed. State of New York, totally different thing, right? As long as you're a licensed clinical social worker or a licensed clinical psychologist or psychiatrist, you diagnose. Okay, so that's pretty much what separates, I think, us from other disciplines. Diagnosis and assessment, and then the treatments that we do as well.
Okay. All right. So I'm going to follow up with a 2-part question.
Yes.
So what are the most common disorders that you treated? And also during the pandemic, did you see a spike in any disorder or disorders that requested a specific treatment?
Absolutely. So first, I am a child psychologist by training, but as a function of being a child clinical psychologist, I work a ton with parents, and then as a result, I work a ton with adults. Okay. So the most frequent thing that kids come to me for is ADHD or an anxiety disorder. So all of the clientele that I typically get is kids who are struggling with behavioral symptoms in the classroom, behavioral symptoms at home, and that's typically anxiety or depression. the adults that I see are largely anxious, depressed, and also sometimes meet criteria for ADHD. Mm-hmm. So that's like my specialty.
Gotcha.
Those 3 areas. During the pandemic was like an influx of anxiety and depression, right? So for kids, anxiety and depression kind of tend to co-occur. We say it's really hard to tease those apart in kids. Mm-hmm. For adults, I can try to figure out, like, are you more depressed or are you more anxious? Mm-hmm. Are they both separate or they intertwine, right? And so during the pandemic, it was like a major trauma for us all. And it was a complex trauma. So we had racism stuff happening. We had not knowing what was happening with this disease. We had family members who were dying, people getting it. We're not sure if they're going to be okay. We're stuck in our homes. And so anxiety was high, very high. And so the treatment for that is cognitive behavioral therapy. And one of the evidence-based treatments for that. And that's one of the things that I do.
Okay. All right. So during the pandemic, I'm going to stay on that topic.
Yeah.
As you saw, there were a lot of professions that started losing counterparts and coworkers. Did the pandemic, did you all in that field suffer a shortage, or you say has the field recovered from that point?
Okay. It was like we couldn't come up for air. The demand was so high and the numbers of us are so low. Mm-hmm. And so what I'll tell people is, like, you don't have to just be seen by a clinical psychologist. There aren't many of us. And when it comes to Black clinical psychologists, we're less than 1% of, like, the numbers are very small. Mm-hmm. And so what you really want is you want to know that the therapist that you're seeing is doing some evidence-based intervention. So I just want to do a plug for that. Okay. Evidence-based intervention. That means there's data, there's research to support that the strategies that they're employing in therapy are actually beneficial for what you're going through. So that's number one. But yeah, it was like we couldn't come up for air. And so the hard part about the pandemic for many providers was that, you know, we're trying to book so many people because we know there's not a lot of people for people to see. But then in terms of your own work-life balance, you're sitting in a room talking to other people about their problems all day long. And then you got kids on virtual learning. You got your significant others working at home. And you have your own emotional health and well-being.
Correct, right.
Many of us had to make sure we were in our own therapy. I know I did. So we had to be in our own therapy while we were going through pandemic.
Okay.
It was something.
Okay, man. I bet it was.
Yeah, it was deep.
Yeah, I know it was. So also, what do you feel just in your profession is the biggest challenge that you face?
Biggest challenge that I face in my profession is that we don't have enough Black people doing it, especially Black men. And so there's always getting calls from parents. Right. Do you have a Black male psychologist you can refer us to for our son? Even some of the Black men that I've worked with, like, I work with them and I get to a certain point, I'm like, oh, I need you got to get a male perspective and a Black male perspective. And we used to say it's like finding a unicorn, you know, because I've been able to tap into a few Black male psychiatrists, but I have an even harder time finding Black male psychologists. They're more licensed clinical social workers, but we really need ourselves represented in the field. And that, I think, is big. Like, there are lots of barriers. It's a time consuming, expensive process to become a psychologist. Yeah. There are not a lot of training programs that are just going out trying to bring Black people on, right? My training class at DePaul was a class of 6. 2 of us out of the 6 were Black. And DePaul was like, in my opinion, it was almost like a HBCU because every class had at least 2 Black people. Oh, wow. And so the time when you're in school, there's probably about 4 classes on campus at a time. So that's 8 people. That's unheard of in most clinical programs.
Oh, wow.
You know, so that's why you hear people talking about another route is the PsyD, the Doctorate of Psychology, which is a program but you pay out of pocket for those programs, and it's very expensive. A PhD program is paid for you, and you work. Okay. So social work is another way that people get into the field because it's 2 years. You're paying for 2 years of schooling rather than 4 to 5 years like with a PsyD or with a PhD waiting on somebody's funding. So I could talk all day about that. I don't want to bore you all.
No, you're not boring me at all. I'm tuned in. I'm leaning into the camera like, keep going, please. Keep feeding.
So it's just it is a lot. Like,
Okay.
we really need Black people in the field.
Yes. Okay, audience, you hear that. I hope this sparks up an interest for somebody out there. Seriously.
Yes.
Yes, definitely. So, and you talked about just during the pandemic, but this is not just related. My next question just related exclusively to the pandemic. It was talking about when you're with your clients, how do you maintain your boundaries during a counseling session, because you're just so interpersonal with them? You're getting way in depth. So how do you deviate that when you have to maintain, like you said, your own personal life and everything else going on?
So that's one of the core tenets of our training is like ethics, and and part of the ethics code is appropriate boundaries. So I have patients that I'm like, if you were not my patient, we would hang out. Or I know you probably know some of the same people I know, and we run in the same circles, or I know I've seen you before. But it is it is contraindicated to develop personal relationships with the people you treat, because in psychology, it's really important to have boundaries, because in many cases, people that you're working with are there because they have not had consistent boundaries. The people in their lives who parented them, their families, have violated boundaries, right? And you don't want to perpetuate that in your work. And so it's really important that you know you're not a friend. So one of the things, I think I mentioned this to Tevis before, some of my friends have said, "Oh, you're a bad psychologist because of the advice I give them as a friend." And I say, "I'm your friend. I am not your therapist. The things I tell you as a friend, I would never tell you as my patient." Okay, so there is a difference. There's a balance, and the boundary is also important for us, because we need to make sure that we don't do harm, right? Right. So if I start to join you in your life, and I'm coming to your birthday parties and making recommendations and overstepping, right, there can be some negative impact, right? We can get confused about roles. Like in the state of Georgia, when you take your exam here, they talk about sexual relationships. We lose our licenses if we ever enter into a sexual relationship with a patient. Doesn't matter how long it's been since you've worked with them. To have a friendship is supposed to be 5 years, right? It's supposed to be 5 years post having worked with. That's how serious we take boundaries, because people have been manipulated by people in positions of power. There have been psychologists who have sexually abused their patients. Or who've entered into inappropriate sexual relationships or friendships with their patients. So what I have to know is, no matter how much I like you and how much I want to be your friend, I'm not your friend. I have friends, but I enjoy working with you, right? So it's like very clear. You know, I've been out in Atlanta and I've seen my patients. It is our ethical code that I do not acknowledge my patient if I see them out. I can wait for them to approach me. Should they approach me, then I can greet them. If they don't approach me, it's like, you've never seen, I don't know you, you don't know me. It's confidentiality, right? If I talk to you, you're out with your significant other, they don't know you're in therapy. And I say, "Hey, Joe." And they're like, "Joe, who was that?" Right? "Oh, that's my therapist." "Oh, I didn't know you was in therapy." Or, "Oh, you don't want to tell the person you're in therapy, so now it's an issue." Because she's like, who was this talking to you, Joe? So, like, you can see how this could go in a different way. So I'm being silly about it, but it's like, we really have to protect people's confidence.
Definitely. I totally understand. And look, let's take a break for a second. And we want to make sure we maximize our time, because I do not want Kristin sending me an invoice. All right. All right, we'll be back in a second.
Have you been feeding your skin quality ingredients? Are you dealing with any type of skin condition such as eczema, hyperpigmentation, body acne, or discoloration? Here at Joy House Essentials, our triple whip shea butter is 100% handmade and whipped to perfection, guaranteeing results you will see and feel instantly. Give your skin the nourishment it deserves and stop using harmful, chemical-based products today. You can find us at www.thejoyhouseshop.net or give us a follow on Instagram at JHEShop. Joy House Essentials. Let's elevate together.
So we are back. Kristin, you had mentioned earlier you are a trained child clinical psychologist. So is within that realm, is there like a specific niche or anything that you particularly cater to? like with just counseling children and like their parents and everything.
So there's a niche that I have fallen into over the last couple of years since I transitioned to Atlanta from New York. I originally was like ADHD parent training, school consultation, parenting person.
Okay.
And now I've become a high conflict co-parenting person and therapist to kids whose parents are experiencing child custody issues. So I will either serve as the kid's therapist that's like court ordered because the kid has witnessed so much drama between their parents, or the kids have been forced to be separate from a parent, or I'll serve as the co-parenting therapist for two parents who can't seem to see eye to eye.
Gotcha. So you're like a mediator for the parent.
Yeah.
Okay.
They go to mediation with the attorneys, and mediation does not work.
Yeah.
And then they say, okay, now you have to go see this therapist, and you all have to figure it out. And then they go back to mediation or back to court. And so that's what I've fallen into here in Atlanta.
Okay. And you've done this particular, has this been for like a couple of years, like 3 or 4 years?
So it started off in New York. Some of the kids that I worked with just happened to be in situations where their parents were divorced and they didn't get along.
Gotcha.
And so that was like first introduction to navigating a kid who is experiencing behavioral symptoms at home and at school, and their parents don't get along. What came first, chicken or the egg? Mm-hmm. What's going on? How do I get these parents on the same page? You know, it could be as simple as, are we going to accept ADHD medication for our kid? This parent says, no, I don't believe in meds. This parent says, yes, meds will help. And then the schools, and helping them to kind of have those conversations. And when I got here, I ended up joining a team of psychologists. We all practice independently, but 2 of the people on the team did a lot of this work. Okay. And they were like, Kristin, we need somebody to do this work. Okay. So I said, okay.
Okay. So, just a quick question. So you mentioned medication. So are you the one who prescribes this medication, or is it the doctor, or is it like a, what's the other one?
Psychiatrist. You got it. Excellent question. So the difference, I think this is something people need to know. The difference between a psychologist and a psychiatrist is a psychiatrist is a medical doctor. They go to medical school, they go to residency, they go to a fellowship, and they have the ability to medicate.
Gotcha.
They write prescriptions. In certain states, psychologists can take additional courses to gain prescription writing privileges. So I believe in Illinois, psychologists can go back to school and take courses, but that's not what I do. Psychologists do not medicate unless they're in one of those states. We all try to stay in our lanes. The psychiatrists typically medicate, and some of them do therapy. Psychologists and teach. Psychologists do research, teaching, and therapy. Social workers do therapy and teaching, but psychiatrists are the only ones who medicate. So no.
Okay. So, I'm just like any other field, like you have to stay on top of the new things, I don't want to say trends, but new education, new type of therapy. So how do you like your particular?
Okay, so what we do is we're always at a conference. So in order, like always at a conference, and there's always articles coming out. And so I'm a member of a couple of organizations. I'm a cognitive behavioral therapist. So what that means is I think thoughts, feelings, and behaviors are related. And that if I can get you to be aware of thought patterns, I can change how you feel and how you behave. There's an association. We go every year, get our continuing education credits, see what the newest research is out there in the field, engage with peers, right? Then I'm a member of the Association for Family and Conciliation Courts. And that's all about what's in the best interest of children when it comes to child custody issues. And so constantly doing that. But we have requirements for continuing education. Okay. One of those is going to conferences, getting trained, making sure you are certified in some type of evidence-based therapy. And trying to stay on the cutting edge.
Okay. So shifting back to like specifically your session.
Yes.
Do you have a particular structure that you follow, or is it like, okay, it just is for each patient is something different? And typically, how long is a session for you? Because I know you're dealing with children.
Yeah.
The attention span is completely different than what it is for adults and everything. So.
Okay. So for kids, I'm typically doing a 45-minute session.
Okay.
For adults, I'm usually doing a 60-minute session. The session typically starts with us setting the agenda. So you're coming to me, it's your session. You say, hey, Dr. Kristin or Dr. Carothers, I want to make sure we talk about this situation with my mom, these thoughts that I've been having, and my appetite. I say, okay, that's on our agenda. We go through each of those issues. You describe to me what the problem is, how it's making you feel, what you're noticing that you're doing, how you're thinking about it. I ask you questions to help you gain insight about why different things might be bothering you. I help you to identify some patterns and maybe the people you're around when you experience symptoms, the time of day. Is this linked to some historical trauma? So I'm a trauma person. And we try to like figure out where this is coming from, identify what you've been doing or thinking that's making you continue to have these symptoms, and try to come up with like a stepwise plan. Okay. Now, in one session, we ain't gonna figure it all out, but I want to have at least something tangible that you can do to either change your mood or to change your behavior.
Okay.
For the next week.
Okay.
But I've got to make sure I'm not pushing you too fast, because sometimes when you push people too fast, they don't come back because they're embarrassed if they haven't done what you told them to do over the week. So I'm a more directive therapist. Now, other types of therapists, you come into the room, you sit on the couch, the therapist says nothing until you speak. That's a more psychodynamic approach. So that's also another type of therapy you may experience, right? Some people are more solution focused. You come in, you say, I'm having a problem with my mom, and they're like, let's problem solve it out. Other people are more like insight oriented, and they want you to kind of just talk about what things have meant for you. So it really depends on the type of therapy you're in.
Okay. So we're coloreds, the blacks.
Yes, coloreds.
What would you say is like a major or a common misconception about psychologists and actually going to therapy? I'd say let's start with the Black community, and then we can delve into just in general, what are some of the misconceptions about?
Let's go.
Yes.
You saw that. Did y'all see the meme where it was a video meme? It was something that was on Instagram. And it was like a person saying, so you telling me to go talk to a psychologist about my problems when they have problems? Did you all see that?
No, I haven't seen it.
It's a video. And then people took it and said, well, you telling me to talk to a dentist about my teeth when they got teeth? You telling me to talk to a hairstylist about hairstyles when they don't know how to do their hair? Like, listen, nobody is saying that a psychologist or a therapist is a perfect person. What we're saying is that sometimes you need an independent third party, somebody who is not your family, your friend, your pastor, who is not like intimately involved in your everyday life, to give you some insight, to just sit and listen and give you some insight. Number 2, going to therapy does not mean you're crazy or that your elevator didn't go to the top. That's what my grandmother used to say. You didn't go all the way to the top, right? Going to therapy is simply like a space for you to be able to talk and not to hear everybody else's opinion. Something is bothering you, something's there that you need to get off your chest. And this person, you pay them, and they're going to sit there and they're going to listen, say nothing. And then they're going to give you something that's going to be different than what your mom, your sister, your brother, your uncle, your cousin is going to give you, because they are trained. You work with lots of people who've dealt with this. You're not alone. So for me, for Black people, we've been taught to be very private. And that's because we have like intergenerational transmission of trauma. People have done us wrong. We did not create psychology. Okay, psychology, it was largely created by the Jewish culture, right? Created by another culture. This is not what is the norm for us. And so accepting that help or seeing it as okay can be tricky, because it's like, well, if I share with people, how will they use this against me?
Yeah. No, that's that's real. It's just, so I'm in therapy. I'm very transparent about being in therapy. And initially it was just like, what I'm telling you all this, how is this going to come back to bite me?
You gonna tell?
What how are you gonna use this against me? And it just took a while of, okay, this is not to be used against me. This is to actually help me. But I guess that is like the mentality of most people of how are you gonna use this against me later on?
Right. How will this blow up in my face?
Mm-hmm.
Like, can I tell that you really won't tell anybody anything? I'm going to tell you all, I was in a restaurant in Atlanta and a famous rapper was 2 tables away from me. And I heard that rapper tell their children, don't talk to a therapist or a psychologist because they can go back and tell people what you've said. I sat there with my other psychologist friend. She was visiting from out of town and she was like itching. She's like, we got to say something. I said, no, we are over here having dinner. Yes, he is spewing misinformation to his kids, but this is how these things get perpetuated in our kids. Yep. The only time I can break your confidence is if I think you are going to hurt yourself, you're going to hurt somebody else, or somebody is trying to hurt you, especially for kids, right? So we have something that's the Tevis law. There was a therapist who was counseling someone. That person told them that they were having thoughts about hurting someone else. The therapist did not disclose to the person that their client was going to hurt, that they were going to be hurt, and that person ended up dead. Okay? Wow. We can't have that happen, right? Yeah. So, or if I become aware that stepmother is abusing stepson comes to session and tells me that, I can't keep that in confidence. I've got to keep this kid safe. Yeah. I've got to report. Okay, this kid is at home taking pills or considering hanging themselves. I can't keep that secret. Those are the 3 things that I tell.
Gotcha.
Okay, like when you speak to your attorney, you've got privilege. Same with the therapist. Okay, so that's what I need Black people to know too.
Gotcha.
Unless it's court ordered, and if it's court ordered, then you need to be very clear about what the therapist's limits are. What can they disclose to the court and what can they not disclose to the courts?
Gotcha.
Okay, gotcha. So what would you say some of the biggest adjustments that you had since you first started working in your field?
Money.
I like that answer.
Okay, sorry. Oh, no. So, let me tell you. You don't become a therapist if you want to. Oh, can you all see me still?
Yeah. Mm-hmm.
Yeah.
Why can't I see you? Give me one second. Okay, I can see you. Sorry. So here's the thing. You go into a lot of debt to get this degree. You come out of school and you don't make a lot of money. My first, my internship in New York, I was making $25,000 for the year.
Wow. In New York.
In New York City,
right.
Harlem. And then my postdoc, I was making about $44,000. And then my first job, I was making about $65,000. And then my next one, it was like $85,000. And I was like, I am a community mental health person all day. I want to help communities that are underserved. How am I going to live?
Yeah.
Right.
And you have to work multiple jobs. You have to have a private practice. You have to teach. And that's what I was doing. I was teaching online, teaching in person, working and doing a few hours of private practice on the side, working at a hospital to get to a point where I had enough money to live. And over time, I burned out. I said, I can't do community mental health anymore. It's highly triggering for me. I'm stressed out. I've been in this since 2005. And at that point, I was getting to about 2014. And I was like, I got to do something different. And I went and worked in the private practice world. But I wasn't working for myself. And so I knew what was the amount of money that was being made for me to meet people. But what I was taking home didn't match that. And then I had to step out on faith and say, nope, I have to do this for myself. So what I want to tell people is when you hear from psychologists that they don't accept insurance, that is often because we cannot earn a living wage if we do.
Okay. Gotcha.
Okay.
Gotcha.
The rate of reimbursement will be very low. We'll have to see 35 to 40 patients to maintain, and it's not healthy for us and it's not productive for you. If I got 40 people on my caseload, there's no way I'm giving you the best that I've got, right? No way. And so many times we will eventually go into private practice so that we can become entrepreneurs, that we can command our own wage. If we have a sliding scale to account for, like, everybody can't pay the fee, that's what we do. I'm still working multiple jobs, but I think what I've seen change over time is when I entered the field, I thought I would always be community mental health and that private practice people were sellouts. Once I got in the game and I did trauma work and worked in Washington Heights and Cabrini Green and every place else, and I'm living in Harlem, and I'm like, this is rough. A lot to, like, do the work and live it. I have to also have some agency or some ability to live well. And so I had to kind of shift my thinking about where I was going to be in terms of career and how I was going to think about money, because it's important.
Yeah. It's very important.
Definitely,
Yes.
Yeah. So you spoke on, you actually answered one of this first part of my question earlier about how patients get matched to the particular therapist, but this is something I wanted to know as well. What should patients look for when they choose a therapist?
Oh, that's an excellent question. I think you may not necessarily find reviews online. Like,
right, okay.
Oh, and sometimes with reviews online, you've got to be careful because typically the people who leave reviews are ones who are not pleased. And so you want to make sure that you're not just kind of looking at reviews. What you are looking for is fit with your problem or issue. If you're saying, I've got a trauma history and I've been through some stuff and now I'm super duper angry, you need to find somebody who specializes in trauma work and who hopefully does some type of, like, cognitive behavioral therapy or exposure response prevention for anxiety, trauma. You want to make sure that whoever you're working with matches what your need is. Okay. Look for people who have trained at accredited programs. Look for people who are licensed. Look for people who seem like they would attempt to understand who you are. You visit the website, you read the bio, you ask people for referrals. Sometimes asking people around you who they work with, they can give you ideas. Even if that person can't see you, they might be able to refer somebody else. So you should be looking for someone who is licensed, someone who's completed training at an accredited program, and you can find all that information out on their bios. Go on Psychology Today, you'll find that information, and then you're looking for a fit to what you're going through.
Gotcha.
Okay. Oh, thank you for that info.
Yeah.
So tell me this. How has, let's get it a little lighter. I want to know,
Okay.
How has your experience as a psychologist changed since you first started working in the field?
How has my experience as a psychologist changed since I first started working in the field? That's a good question. I don't even know how I should answer that. Tell me what you're thinking.
What I'm thinking? Well, you were talking about when you first started working in, like, Cabrini Heights and things, and now you've gotten to this level. Like, what are some of the things that you wish you had have known beforehand besides?
Yeah. I wish I would have had more tools under my belt when I started working. So the way psychology programs work is typically you get pushed into working with clients before you have training. Get your training while you're working.
Oh, wow.
And I remember being like, wait, I'm seeing my first patient, but we just started class last week. Like, but that's the way the thing is. That's the way the programs are set up. Oh. And so for me, I think you need to give us about a year of coursework and watching some other students who have had that year of training, who are now in the trenches, listening to them in supervision, maybe what's it called, shadowing them. But many old school psychologists will say, no, you figured it out. And those interactions that you had with those patients were therapeutic. Just because you learned something different that you could apply doesn't mean that you didn't have a therapeutic interaction. For me, though, I think back to, like, clients I work with in Chicago, And then I think back to like the information I gained from my internship in New York. And I'm like, man, when I was working with that little boy and his grandmother, I wish I had known how to coach her. I wish I had known how to pick out the difference between ADHD and a bipolar disorder. I wish I had known, how to, I hope that kid is okay. Yeah. So that's the type of thing that comes up for me, is hoping that even though I've got more skills now or some different skills, that my interactions with the people early on in my training were still healthy.
Okay.
So.
Okay. All right. Yeah, I believe people can totally understand that and follow that one. And that was a great answer to that.
Thank you.
Okay. So what would be a process for somebody who wants to start a mental health routine?
Yes. Okay. So if you are on the fence or thinking about starting a mental health routine, I think one thing you could do is just visit some websites. Like just jump on a Psychology Today and put in your zip code and just like browse, seeing who comes up in your area. There's a website, Therapy for Black Girls, that specializes in Black clinicians. There's another one, it's like a Therapy for Black Men. There's BetterHelp. I think if you're on the fence and you don't know whether or not you're willing to try it, start to just look at some people's profiles. And then I think it's really important that you reach out to your network to find out who's done it before. Because sometimes we think we're alone, and then we ask and somebody's like, oh yeah, we went to therapy. Oh yeah. It's hard though, because if you got people that are going to poo-poo it or shut you down, then it can make you like not want to do it. There's some people that I follow on Instagram who are amazing. One of them is a lady named Nedra Tawwab. And if you just want some like quick, inspirational, like boundary setting things, because I think sometimes before you go to therapy, you're going to have to get really good at setting boundaries with your family and friends, and people, inviting them out to business. And she is great. And I'm going to try to find her Instagram handle. If you're having issues with parenting, there's this Instagrammer is Latinx parenting, and she explains like why we engage in some of the negative behaviors with our kids that we say are like keeping them in line, but that are really like negative. So I've actually found the social media sites of people who are legitimate therapists to be very helpful. Like just to give you little nuggets of information.
Okay, that's good to know.
Because we are a social media, like
we are. So it's like, no, you don't want to get your therapy on TikTok, but there are, there are certain therapists that are on here that are like, they've got some gems that they're dropping. But Psychology Today is one way to kind of get started.
Okay.
You are taking in everybody else's problems. It's heavy, and what do you do to just kind of offload or make sure that you said you were burnt out just with all these jobs you had before on top of just the mental exhaustion. So what are some things that you kind of do to relax or offload you taking on so much of everybody else's stuff?
That is a great question. Okay, so I have not been excellent in my boundaries around how long I will work and how much I will say yes to. So in 2022, 2021, I'm like, it's the pandemic. I got to make money. I got to build my brand, build my business. I was saying yes to everything. For 2023, I now know I've got to be really hardcore with my boundaries. I got a child. I've got a significant other. My child has come home and I'm still on a call. And he's like, you're not on a call when I get home. That is and my child is very articulate about what he thinks should happen. But that is a boundary, right? I don't want him to think I care so much about other people. I don't have time for him. And so I think for me, having a boundary and being like, I'm done with patients at 6:30 and not responding to a text from a patient or not responding to emails that I get on the weekend. That's big, hard work for me. Not respond. Right? Because I know how to have fun. Tevis was here for my birthday party. I know how to kick it.
It's not.
That's not the problem. I just don't know. Sometimes I have to be really good about saying no. It is 6:30. or I get a call, it's an emergency, my kid's being kicked out of school, can you see him tomorrow? No, I can't. If it's an emergency, you got to go to the emergency room. But I can maybe see you in a week or two. So it's really about boundaries, time. That's my self-care, is having a boundary, because I don't sit still. So I can't lie and say I'm going to go to the spa. Now I do go for those massages at the, at the mall.
Yeah.
That's a that's great.
Those mall massages, people be asleep.
10 minutes. Don't sleep on that mall
Look, those mall massages don't.
They get you right.
They are.
10 minutes.
I'm not going. I'm sorry. I'm not going. Nope.
10 minutes of a mall massage. That's all you need. Like shoulders, and then go on about your day. But I listen to audiobooks. I listen to audiobooks because I have long commutes in Atlanta. Getting into podcasts. Podcasts. But like listening to things that are like, just kind of take my mind away. And then every now and then I'll binge a weird like European 1700s, 1800s like royal show. Like, I don't know why. Those types of things.
I mean, it expands your mind. I mean, it takes you somewhere else, gets you out of the norm. So I get it.
I can't watch anything like related to like real life.
Gotcha.
Huh? Okay.
So you kind of covered this a little bit earlier, but you said it is almost impossible for you to make a good, healthy living by accepting insurance. So, do you accept insurance, or are you mostly just a out-of-pocket pay situation?
Yeah, right now I am only out of pocket.
Okay.
And I work different contracts. So like I have my private practice. I have a contract that I work, like a couple different businesses going at the same time. And it so far has afforded me the opportunity not to accept insurance. I'm very grateful for that. Yeah. But I know many people, that's how they get their starts. So what I'll say is, to young professionals in the field, you can definitely do that to get your start if you don't have a funnel of clientele.
Gotcha.
Once you get your niche and you can funnel your clientele, then you can slowly kind of taper off of that. Okay. For people who need to use insurance, it's okay. Also, do your employee assistance programs. Like, get those 6 sessions. If you get there, that's really a good way to get started too.
Okay. So, you kind of, again, went into the next question, which is like, so if you are an aspiring psychologist, and you're just getting started, can you give them, what advice would you give them besides like, okay, start with the insurance to kind of build the clientele up? Is there anything, any gems, or advice you wish someone would have told you starting out that you can offer to someone out there who's like, okay, I want to get into this field, but I don't really know what I should do? How I should anything.
Okay. Yeah. If you want to get into the field, like you haven't done the academic piece, consider checking out some conferences. When even conferences can be expensive. Let me say this. How did I get my start? Really, I had to talk to people who were in the psych department at whatever school I was at and ask them, what was the path? What did I need to do? You got to get mentorship. So you've got to reach out to people in your circle or people that friends of friends who were psych majors, who know psychologists, to figure out what you need to do. Typically, first step is go to school and become a psych major. Take some courses. You will get an understanding of what it takes to stay on the path. Once you've gotten on the path, and let's say we're talking to people who are trying to establish practices, I learned from my mentor, Dr. Kathy Granite DePaul, was whatever she didn't know how to do, she found somebody who knew how to do it and she took them to lunch. Gotcha. You build relationships. Mm-hmm. So if you're starting a practice and you need clientele, you talk to pediatricians. You go over to doctors' offices. You go to schools. You places where parents, children, adults are. Doctors' offices, schools. I'm going to tell you, doctors' offices are always looking for therapists to refer their clients to. Most people present with physical symptoms before they're aware that it's actually an emotional problem.
Okay.
And so doctors are excellent resources to start your pipeline.
Okay.
And then if you're going to take an insurance, take one.
Okay.
and then build without. So do one.
So when you say take one, like maybe you just take
do Blue Cross
or something.
Do Cigna.
Okay.
Choose one.
Gotcha.
The one that has the best reimbursement, has the lowest amount of like stress for you, and you accept that one.
Gotcha.
And then you try to build privately around it.
Okay.
But you want to make it manageable because the insurance companies require lots of data. And it can be very hard to keep up with. Okay. So if you're going to go that route, start with one and then build up your referral sources.
Okay. Well, Kristin, it was a great information session because there's a lot of information that I didn't know, and I'm sure our listeners didn't know. So I appreciate you taking out the time of your busy schedule to talk to us, educate us, enlighten us. Maybe for someone listening, making this not such a scary place to go to. You offered some excellent resources for people to, just kind of start their journey if this is something that they feel they should do. I feel like everybody needs to be in therapy. I say it all the time. You need to talk to somebody.
It's so nice though, and I don't think people notice that. It's so it can be cool. It's scary at first when you go into a room with somebody new, but to just sit and be heard.
Yeah. And to have an unbiased opinion about something is very helpful. It's just I never would have looked at it like that.
Mm-hmm, mm-hmm.
We thank you so much for
talking. You guys.
Do you have any social media, or how can patients, clients get in contact with you if they want information or anything like that?
Sure. So I have a website. It is Dr. KJ Car and others.com. So DrKJCarothers.com. It will be, it's open now, but it's being revamped. Okay. And then I do have an Instagram, but I have to tell you all what it is because I have to get good at it. My Insta is Dr. Kristin Joy. It's just DrKristinJoy. And so right now I'm actually working on revamping the website, but there's plenty of information and ways to get to me if you just check the website.
Okay. Well, thank you again so much. I'd like to thank our listeners for tuning in. If you are new, hit the subscribe button. We are offered on every single platform that there is. No excuse not to listen to us. If you are a regular listener, tell a friend, tell somebody, because something out of all of these podcasts is going to help somebody. So,
I love it.
Please tell someone about us, subscribe, and thank you guys for listening. Again, this is Tevis from Talking in the Attic, and
it's William J.
All right. Thank you guys for listening.
And we are gone.
All right. Bye.